Uneven eyes fixable with surgery? I would like to know if it would be possible to fix my uneven eyes with surgery. I fell down some stairs at the age of 3 and have a scar on my right eye. I think it's the reason my right eye is droopy. I've also had eye bags under my eyes since late 20s and sick and tired of people telling me I look tired. I was thinking of having the eyelid surgery to correct the unevenness and lower blepharoplasty to get rid of bags. Also, would it be too complicated to get rhinoplasty at the same time?
Thank you for your question. You've submitted a question about improving the uneven quality of your eyes, and you drew some very nice horizontal lines to demonstrate that. And you're also concerned about bags under the eyes. Well, to begin with, the reality about the face and the human face is that it is intrinsically asymmetric. That means that one side is always a little bit different than the other. Now, in some people, it's more pronounced than the other side, I should say, more pronounced compared to other people, where if you were actually to take a picture of yourself and you split the picture in half with a program like Photoshop, and then you flipped it and opened it up so that you doubled it, one picture would look very narrow and the other picture would typically look very wide. So intrinsically, we're all imperfect, and that is part of the character of your face. Now, the key thing to understand is much of the difference in one side versus the other has to do not so much with what's on the superficial part of the face, like the skin, but rather it's about the bone structure, okay? There's a term that we use called hemifacial microsomia, and it just basically means that one part of the face is smaller than the other side. So when people come to me in consultation about making themselves more symmetric, I always explain that I can improve symmetry, but I cannot perfect it, because there's so much more deeper levels of bone structure that is responsible for this difference that we can only take it to so far without discussing options which are unrealistic and disproportionate to what the cosmetic concern is. So the question about helping improve symmetry, certainly we can do that. We do that routinely. Sometimes with eyelids, one person's upper lids is a little bit heavier on one side compared to the other, and sometimes the bags on one side can be a little bit more than the other side. And very often the cheek projection can be different on one side compared to the other. So we can compensate for these things by customizing the surgery. And that's the art of doing cosmetic surgery, is taking all of these factors into consideration when you're doing the procedure. I do my procedures under local anesthesia with light sedation. And whenever I'm really concerned about maximizing symmetry in someone where there's a lot of room for subtle improvement, I'll actually have their cooperation. They won't feel anything, but I'll ask them to open their eyes and look from different angles, and I may even sit them up just to see how things look and make sure that I can maximize the symmetry. As far as treating the under eye bags are concerned, this is a very common problem in my practice of cosmetic oculofacial plastic surgery, is having bags under the eyes. Now, there are different methods of treating the bags under the eyes. One is called a transcutaneous approach, which means making an incision underneath the eyelashes to access the bags, and those bags are fat pockets, and those fat pockets are often referred to as herniated fat. The other approach is a procedure called a transconjunctival blepharoplasty, and that's basically an approach where we do the surgery from the inside of the eyelid. In my practice, most of my lower eyelid procedures as a primary procedure, not as a revision or secondary procedure for patients who are referred in, I tend to do a lot from the inside of the eyelid. I find that preserving the muscle shape and the integrity of most of the anatomy of the lower eyelid really it works out well by just being able to get to that fat. We can do other things such as skin pinch, removal of a little extra skin, or lasers and PRP to improve skin quality. So there are a lot of different options, and also depends a lot on the tone of the eyelid and which procedure is right. It's not just the approach, but also some of the support procedures. One of the most common pitfalls of lower eyelid surgery is something called lower eyelid retraction, which is a pulling down of the eyelid, which is much more common than most people realize. It is actually, the lower eyelid is deceptively complex, and the dynamics of support and maintaining a natural look has a lot of subtleties to it that requires tools in the toolbox of someone who has a lot of experience dealing with these kinds of procedures. So, in summary, we can do something to improve symmetry as long as your goal is not unrealistic and you're not aiming for perfection. And yes, we can do a lot of different things to help improve the bags under the eyes to further enhance the overall appearance. The take-home message also is, you look at yourself with we all do this, naturally we look with very strong detail and focus, and then we magnify everything. While other people look at us and they see the whole picture. And so no one's looking at us unless they really are very close, and they do that a lot, but most people look at us in 1 millisecond snapshot. And as long as you look well rested and you look good, if that's your objective, then I think you should have a good journey in finding the right doctor for you. So I hope that was helpful, and thank you for your question.